welcome to Captain's Trading. I am your host, the Captain. We're going to be starting here a series called Ticker Talk, where we'll be going over a different ticker each week and presenting at the end both a bearish and a bullish take, leaving it for the viewer to decide. Today's ticker will be 180 Life Sciences, ticker ATNF. They develop pharmaceuticals for chronic pain and inflammatory diseases. It operates as a clinical stage biotech focused on development of novel drugs that fulfill unmet needs in inflammatory diseases. It was founded in 2016 and is headquartered in Palo Alto, California. At the time of this recording, ATNF had a market cap of $176.26 million, a public float of 19.58 million, 85,000 shares available to borrow according to Fintel, a borrower rate fee of 32.69. The share price at the time of this recording, a whopping $5.28. So for the leadership, we're going to go ahead and start out with the CEO, a Dr. Jim Woody. Wrong Woody. Either way, Dr. James Woody, PhD, has more than 25 years of pharma research, notably part of the team that discovered Remicade, which is used for arthritis, is one of the best-selling drugs in the world. He also served as commanding officer and director at the U.S. Naval Medical Research and Development Command in Bethesda, Maryland, and was awarded the U.S. Navy Legion of Merit. There's a ton of info here. Don't worry, there will be a link in the description regarding the website and where you can go and get more in depth on all these people. Up next, we have the co-founder, a Professor Sir Mark Feldman, who received a knighthood for his work with ATNF therapies. And I've seen this guy before.
Great Scott!
Now, all jokes aside, he has an extremely impressive resume. Not only is he a professor at Oxford, but in the 1980s he identified TNF as a target in the treatment of arthritis. Naturally, this led him to be on the team that discovered Remicade. Moving on, we have co-founder Professor Lawrence Steinman. He is chair in the neurology department at Stanford. Professor Steinman was instrumental in discovering the application of Tysabri in treating multiple sclerosis. The drug was sold for $2.85 billion. He earned a Lifetime Achievement Award in 2011 for his work with multiple sclerosis. Moving on, we have Chief Scientific Officer Dr. Jonathan Rothbard. He works in the neurology department at Stanford University, I'm guessing with Professor Steinman. Dr. Rothbard has been involved at a high level with startup pharma, including Amylin, which sold to Bristol Myers Squibb for $5.4 billion with a B dollars. We also have the chairman of Clinical Advisory Board, Professor Jagdeep Nanchalal. I'm probably butchering that name. He is a professor at Oxford. He has pioneered the treatment of fibrosis of the hand, which is Dupuytren's disease, which can be diagnosed early. He is now leading the Phase 2b/3 trial that's funded by the Wellcome Trust and UK Department of Health. Now, this is an important one. We'll come back to this later on in the video. Next, we have co-founder Raphael Mechoulam. He is father of the cannabis research. He's been working on cannabis research for over 50 years. Now, I'm so glad to know that I actually have something in common with one of these members of this team. My research has been completely personally funded, and it hasn't been quite going on for 50 years, but I'm hoping to reach that point. And now we come to the CFO, Ozan Pamir. Ozan is a former VP of an investment bank. He then went on to become a venture capitalist. Ozan holds an economics and finance degree from McGill University. We have scientific director Fiona McCann, PhD. She is an immunologist. Fiona has obtained her PhD from studies at Pfizer and the University of Kent. This right here is 180 Life Sciences pipeline. We have Dupuytren's disease. The results for that are already in. They're expected to be releasing top-line data around Q4. Frozen shoulder should be starting here in Q3 sometime soon. POCD, NASH started Q2 2020. Chronic pain, early arthritis, smoking cessation, induced ulcerative colitis. Very impressive pipeline, addressing a lot of things. We'll come back to some of that later on. The bear thesis here on this ticker is Well, it's all over the place. I've heard things about broccoli. I've heard things about Antifa. I mean, there's some outlandishly crazy bear theses out there. However, the only ones that could actually possibly hold water are ones that you could basically apply to any clinical stage biotech, and that is they're not making anything at the moment. There's no revenue really coming into these companies. Although the other part of that is basically that there's no guarantee of success. A bad trial, no approval, these could all mean the stock could tank. So that's the general gist of the bear thesis there. The broccoli one is interesting if you ever want to look that up.
Great one that took a do.
So the bullish thesis here is pretty straightforward. They've assembled the dream team of bio into one group, and the bulls expect success. Bolstering that bullish thesis is that Jagdeep Nanchalal has been invited to present a keynote talk to the British Society for Surgery of the Hand. That's going to be happening on September 9th. The title of his talk is going to be From Biology to Treatment, Anti-TNF and Dupuytren's Disease. Like I said, he's going to be the keynote here, so that does bolster the Bulls' case a little bit. So we're at that point where you have to ask yourself, are you a bear? Do you believe that their trials are destined to failure, and investing here is like burning your money in a flaming mattress stuffed inside of a dumpster? Do you believe that a panhandler in a cornfield has a better opportunity of making revenue than this company? Or are you a bull? Do you believe that this dream team of bio is going to come through and deliver Lambos and flour bags of cocaine to all of its shareholders? Do you believe that the Jagdeep keynote is significant in any way? Perhaps a nod to things to come? And that will just about wrap up this video. Remember to like and subscribe. Comment down below, are you a bull or a bear, and why are you what you are? Also, any suggestions that you have for upcoming tickers, the top voted one will get the next week's video. So any stock that you're bullish or bearish on and you want us to take a look at here, go ahead and post it on here and we will do a video of it. Until next time, remember to spade and neuter your goldfish. We will catch you on the other side.